Well, good afternoon, everyone, and thank you for participating in today's TVMA webinar using telemedicine in Texas. This is Chris Copeland, TVMA's Executive Director. I'm coming to you from the Austin offices of TVMA. A few housekeeping things before we get started. As I shared in the invitation to the webinar, there's a limit of 150 participants. We still have some room here, so I don't know that we'll get past that number of 150. But if you know of someone who couldn't make it or wasn't able to access the webinar, we are recording this and it should be available for viewing on the TVMA website by tomorrow on our COVID-19 updates and resources page. Just visit www.tvma.org and click on the Updates and Resources tab, and that will take you to a copy of this presentation. As for the webinar itself today, all participants will remain in listen-only mode throughout the webinar. However, we welcome your questions and ask that you use the chat feature to type in any questions that you might have. There should be a chat bubble icon on the control panel on the top right portion of your screens. So just click on that and it will open a box into which you can type your questions. We plan on leaving about 10 minutes at the end of the presentation to allow Dr. Teller to answer any of the questions that you've submitted. Just a little bit more information about the webinar today. It's due in large part to the responses TVMA received to a survey we sent to members a couple of weeks ago in relation to COVID-19. In addition to over 25% of respondents who indicated that their use of telemedicine in response to COVID-19 had increased, there was also a large number of members who stated that they weren't currently using telemedicine, but it intended to start now. With that information in hand, we decided it would be a great benefit for members to have an expert on telemedicine provide a webinar for us. And that has brought all of us here today. So let's go ahead and get started. Our presenter today is Dr. Lori Teller. Dr. Teller graduated from Texas A&M University College of Veterinary Medicine and is a board-certified diplomat of the American Board of Veterinary Practitioners in canine and feline practice. She worked in private practice for many years before joining the faculty at TAMU CVM as the Clinical Associate Professor of Telehealth. She's very passionate about her teaching role as well as telemedicine and its growth in the veterinary field. Dr. Teller is a past president of the Harris County and Texas Veterinary Medical Associations. Recently, she was honored with the Visionary Award by the Southwest Veterinary Symposium. She currently serves on the AVMA Board of Directors as the Vice Chair, is a trustee for TVMA's BPAC, and was a founding board member of the Women's Veterinary Leadership Development Initiative. She has a monthly radio show spot on Houston's NPR radio station where she highlights the importance of veterinary care for dogs and cats. With that said, Dr. Teller, the floor is yours.
Great, thank y'all. Glad to be here and hope I can provide some relevant information for you. And as Chris said, we'll definitely try to save some time at the end to answer any questions. So with all that, we'll get started. The big thing, the thing that weighs heavily on everybody's mind whenever we start having a conversation about telemedicine is the VCPR, the veterinarian client-patient relationship, and the laws and rules around those. Especially right now, those are extremely varied, both at the national level and at the state level. So this is just the AVMA definition of the VCPR found in the Practice Act. It also reflects what we do in Texas, that you're assuming responsibility for making clinical judgments, that you have sufficient knowledge of the patient. And ultimately, in Texas, you cannot establish a VCPR without having a hands-on physical exam the first time you see this patient. The AAVSB, the American Association of Veterinary State Boards, recently updated their definition of the VCPR, and they still say you need to be willing to assume responsibility for making medical judgments. You need to have sufficient knowledge of the animals. You need to be available for follow-up. However, you do not need to have a hands-on physical exam to establish the VCPR if you are comfortable with the knowledge that you have otherwise. This is where the FDA was before the COVID-19 crisis. Same as the AVMA, that you could not establish a VCPR through telemedicine or electronic means. There you could use the VCPR, use telemedicine once the VCPR had been established. However, COVID has brought about a new definition from the FDA. Well, not a new definition, but they have waived they are using enforcement discretion. So if you choose under federal law to establish a VCPR remotely, then you can do so when it comes to extra label drug use and veterinary feed directives. Yeah, advance. The DEA has also come out with a similar proclamation that telemedicine communication can be conducted using an audio-visual real-time two-way interactive system, and that the practitioner is acting in accordance with applicable federal and state laws. And as y'all know, for the DEA, veterinarians are considered practitioners, and we are encompassed in this proclamation. Earlier last summer, our licensing board summarized the stance on the VCPR here in Texas, and you do need to establish that with a physical exam or timely visits to a farm or ranch to see a herd. You cannot establish a VCPR solely by telephonic or electronic means. And then COVID hit. And this is what they came out with just a few weeks ago. You still may not establish a VCPR solely through telemedicine or electronic means. However, they're also encouraging us to use telemedicine using our best judgment. So what does this mean? When we look at the FDA, the DEA, and what our state board says, you still cannot establish a VCPR without having seen the animal or the herds. But nowhere in Texas statute does it define how long you have to go between visits when you see the herd or put your hands on. So if you have a patient that is coming up on a wellness check and maybe they need a refill of heartworm prevention, but the person's at high risk for coming into your clinic, you can, under this, go ahead and dispense a couple of months of heartworm prevention without putting your hands on this patient. So those are the kinds of things to think about. You can certainly get a heartworm test when this blows over, shelter-in-place orders are lifted, things like that. Telemedicine, virtual care is not just about a FaceTime call. There's a lot more that goes into it. There are certainly devices that can be hooked up. You can see ultrasounds, echoes, radiographic images, but just a FaceTime call, while very simple, is not just what virtual care is. You're also not capturing data, record keeping, things like that. So let's talk about what some of the benefits of virtual care are. Big things are access to primary care. At this time, geography could even be a block away, but certainly financial, transportation, weather conditions, access to second opinions, now more than ever, allowing employees to work remotely whenever possible, a way to maintain the bond between you and your client and patient. We do have peer-reviewed articles that virtual care can be less stressful to some animals versus an inpatient visit. There are times when it's actually beneficial to see the animal in its home environment. This can be particularly true with behavioral problems, interactions, things like that. Convenient for the client. It can help provide reassurance or confirmation to a client, and we'll get into this a short while later, if they really do need to come in to the brick and mortar facility, if that visit is truly needed. Rechecks, disaster response, all of those things. And right now, it can certainly be a source of additional income, especially since inpatient loads tend to be decreased. Things that we may be concerned about that go on no matter what, whether we're in a pandemic or not. Misdiagnosis, if you can't put your hands on the animal, auscultate its heart, palpate its abdomen, check its lymph nodes. Inappropriate prescribing of drugs. What if you haven't identified the right problem? Then you may prescribe the wrong therapeutic medications or treatments. What is the liability coverage? And I can only speak for PLIT, not the other coverages out there. PLIT will cover telemedicine visits as long as you are working within state and federal laws. So if you are maintaining standard of care and otherwise operating within the law, then PLIT will certainly defend you for a telemedicine visit. Concerns, at least before this, we're providing a diagnosis and treatment plan without an established VCPR. That would still be the case in Texas. It would not necessarily be the case in other states. Michigan has just mandated that veterinarians use telemedicine before they send anybody into a vet clinic. So Arizona has also waived a lot of their requirements that came out this morning. So things to keep in mind. Other things, confidentiality of client data, security of credit card information, and how will your telemedicine platform integrate with your practice management system. Questions to ask when you're adding virtual care to a practice: how will it benefit your practice? And how it will benefit you now during a pandemic may be different than what you thought before. What problems will you be solving by adding virtual care? Will it benefit your clients and patients? I think certainly during a pandemic, we can answer these questions pretty easily. What are the advantages and disadvantages? What services can you provide? Can specialists use telemedicine? Yes, most definitely. What does a virtual care visit look like? And this will be dependent on the platform that you choose to use. Asynchronous is more of a chat-based kind of visit where they send you pictures and a text and you respond to that when you have time, and then they may respond back to you when they have time, and that can be over a matter of minutes or a matter of hours. Synchronous delivery is typically a live video chat or something that happens. It can be chat-based, but it's happening within a set amount of time, such as a 10-minute visit. And sorry. So what equipment is needed? With most platforms on the client side, a smartphone, tablet, or computer is all you need. On the veterinary side, a lot of these are easier on a computer, but certainly there are plenty that work with phones and tablets as well. You will need something with a camera and a working microphone, especially if you're doing live audio video visits. But even so, if you have a client that you need to upload photos or videos, they're going to need a camera as well. Laws and regulations, certainly the VCPR, any prescribing laws, things like that. Yes, you can get paid for a telemedicine encounter, and we'll talk about that as well. We'll also go over what some good use cases are and what kind of results you should expect. Other things to think about as you do these visits: how can you collect the data relevant to it? How do you integrate it into your PIM system? What kind of support do you need? Ideally, you'd have a platform that is device agnostic, so you can use it with computers, tablets, and phones, and it doesn't matter if it's iOS or Android operated, supported. For people more advanced, you may want to know if a stethoscope or otoscope or an ultrasound can be supported on the platform. How do you configure workflow to accommodate clinicians? Things like that. You want it to be human-centered so it's easy to use both on the client side and the provider side. So we talked about this a little bit: synchronous video conferencing, store and forward, or asynchronous, and then remote monitoring is becoming bigger and bigger, certainly with diabetics, some cardiac patients. A lot of people have activity monitors for their pets, and those are things that you can collect data from as well. So these are just some numbers based on real live veterinary telemedicine visits. And these are the reasons why clients are most commonly seeking virtual consults. Dermatology and gastrointestinal are the two #1 things, followed by limping and pain and behavioral issues and associated other things. Clients may spend an average of 25% more following a virtual visit. So if you have your virtual visits tied to an online pharmacy, you can certainly send medications as well as pill pockets, shampoos, things like that. We know that people who engage in a telemedicine visit are most likely to schedule an appointment within your brick and mortar facility within 3 months. And about 75% of telemedicine visits will result in a referral. Other things, as you start incorporating virtual care into your practice and you're like, I can't do this 24/7. Well, nobody would want you to do it 24/7 or expect you to. But from a timing standpoint, we see that most visits are requested in the late afternoon through the evening, which before the pandemic certainly correlated with when people got home from school or work and they realized that there was something wrong with their pet. And at that point, they were trying to decide if they needed to turn the stove off or bundle up the kids and go to the veterinary clinic or the emergency clinic, or if it was something that could wait till the next day. Just a different visual. This comes from Dr. Aaron Smiley, who's probably approached close to 2,000 virtual visits since he started doing it. And again, you can see dermatologic and gastrointestinal reasons are the most common reasons that people are looking for help through a virtual visit. Other areas in your practice that you can consider doing this. There are certainly things, if you choose to branch out and not just do this with your own clients. Of course, you cannot make a diagnosis or provide a treatment plan, but you can provide education. So basic behavior, house training. We see this a lot with puppies, kittens with scratching behavior, flea control, nutrition. And then once you get within a VCPR, you can do teletriage regarding toxins, wound care, lots of ways to use telemedicine for recheck visits and for follow-ups, certainly for specialty consults, to deliver information to multiple people in different locations. We see this with some of the platforms. They allow you to tie in people that are in multiple places. So certainly at Texas A&M, we could have a student with us in the clinic, but they need to tie in mom or dad who may be footing the bill. We may need to tie in a referring veterinarian who's back at home so that everybody's on the same page and we don't get the messages changed as things get passed down the road. Chronic care monitoring, remote monitoring, and then of course things you may need from the environment. Just an idea of some of the things that have popped up in the literature. So there was an article in the Canadian Journal of Surgery, which is actually a human journal, but this was a lesson in sometimes chat-based virtual care is not enough. In this particular case, the team, there was not a veterinarian on site, that was working with this dog, was transmitting information to the veterinarian, and they were working down one diagnosis, and then the veterinarian finally said, I need to see a video, and they got on a live video feed, completely changed what the dog's medical condition was and what needed to be done. So it's really important. I think what that reflects is know what you can and cannot do with whatever platform you choose to do telemedicine with. JAVMA had an article, we talked about reduced stress when you can do follow-up visits virtually versus having the animal return to the clinic. And then behavior, the Journal of Applied Animal Welfare discussed how a behavior clinic, the one at Tufts, was actually able to be just as effective treating separation anxiety, doing it virtually versus doing in-person visits for that particular case. So let's talk about some of the case studies. Telemedicine is a great and useful tool, but it's something that we need to use very wisely. And I think This was one thing I wanted to bring up before we did that, sorry. For some people, all you need or may want is a triage service for after hours. Guardian Vets is one such service. They have a partnership with AHA. There's another one out there called Pet Triage. But what they do is screen your clients. So your clients call your phone number or go online to your web portal. They get access to a veterinarian who works for one of these triage services. The triage service determines if the pet really does need to go to an emergency clinic, or they can arrange for the pet to be scheduled to see you in the next day. So these are some examples of case studies. This came from Edo Veterinary Clinic in Houston. The veterinarian saw an older cat that a college student had just adopted, did the exam, established the VCPR, noted that the cat was somewhat underweight. The new owner stated the cat was picky. He was not ready to commit to doing lab work yet, so they discussed trying different foods to see if they could get the cat to eat. The owner graduated from college and moved to Dallas, but she had some concerns that despite the fact the cat was eating better, it was not gaining weight, and now it had started vomiting. So she scheduled a telemedicine visit with her veterinarian in Houston, where the veterinarian there did say your cat really does need lab work. The cat owner's fiance lived in Houston, so she chose to come back, where the lab work was done and the cat was diagnosed as hyperthyroid, and they were able to start a treatment plan. This allowed the owner to work with somebody she trusted until she could find a veterinarian in Dallas. This is a rabbit that had been had surgery at the hospital, and after hours, the owner noted that the incision was bleeding and irritated. So the owner reached out to the veterinarian who did the surgery to find out if they needed to go to the emergency clinic or if there was something that could be done. And the veterinarian was able to advise the owner how to care for the incision overnight and then have it returned the next day, thus avoiding an expensive trip to the emergency room. This is an example. Fuzzy Digital Health is a little bit different business model. It's a house call business that comes with telemedicine as part of your monthly subscription. But this was a call that they got from somebody they did not have a VCPR with. The woman was pregnant and was worried about toxoplasma after her doctor told her she needed to get rid of the cat. She really did not want to get rid of the cat. And so through the telemedicine visit, they were able to educate the client, provide her with some information on it. And the owner was very happy that she was able to keep her cat, and now Fuzzy had a new client from it. This is another call that Fuzzy took. A puppy licked a single ibuprofen that fell on the floor. The owner knew that this was poisonous to dogs and contacted the telemedicine platform to see if they needed to go to the ER. The veterinarian on the other end was able to calculate the dog had not even come close to the toxic dose, and spared that client a trip to the emergency clinic as well. Similar story, this dog had a VCPR also. The owner happened to be sitting at work in a meeting and bored and watching her pet on the pet camera and saw the dog basically eat an entire bottle of ibuprofen. The owner sent the camera link to the veterinarian via the platform, and the veterinarian at Fuzzy said, your dog needs to go straight to the ER and be treated. And fortunately, because this was instituted so quickly, the dog only ended up with some mild damage to the kidneys. We are doing what we call the virtual vet program at A&M. Part of this is through our primary care service, which most emulates what you are doing in private practice. And the other part is a referral service for veterinarians who need help with cases at home, especially right now when it is difficult for clients to travel or they're hesitant to travel to a specialty center. And so for COVID, we created a very special appointment type, and it's called, should I bring in my pet or not? And this is alleviating a fair amount of anxiety for people needing to know, be reassured, yes, we can help your pet at home, or no, this really does warrant a trip to the hospital. So just a couple of things, an example of what we've seen. This is Max. He's a 6-year-old cat who had been recently adopted with his litter mate. And the new owner noted that the cat was scratching. One of the cats was scratching very roughly at its ears. There was black waxy debris. One of the cats had excoriated below the pinna, and the owner was very concerned about transporting the cats during the COVID lockdown. She shared pictures of the facial lesions. She was actually able to collect some cotton swabs and drop those off. And so we were able to diagnose that the cat did really have an active ear mite infection and dispense medication for the owner to treat the cat at home. This is Junior. Junior is a longtime patient of the college. He had been adopted a couple of years ago. When he was adopted, he was heartworm positive and had leptospirosis, and he had developed chronic kidney disease secondary to that, and then blood pressure secondary to his kidney disease. And he was due 2 weeks ago for his heartworm test and to get his blood pressure rechecked, but we were really just taking urgent and emergent cases at the hospital, and so we chose to handle this case virtually. We did the visit where the owner could demonstrate on video the dog's condition. It's a well-behaved dog. He was able to show us the mucous membrane color. We could see what the capillary refill time was. We could talk him through how to take a pulse. And at that point, we decided that it was safe to refill Junior's medicines for 2 months and then plan on an in-person recheck when the shelter-in-place order had been lifted. This is another patient. It's a Labrador or mixed breed. The dog's name is Hamster. It's not really a hamster. The owner had been hiking in San Antonio, and 2 days later, the dog started licking. He scheduled a visit. There was no limping, no other significant findings, and we diagnosed it as an interdigital cyst. Again, for the time being, while normally we'd want to see this in person, we chose to treat this virtually with the caveat that if the dog was not doing better at the end of the week, then we would arrange to see the dog in person. And thus far, the dog's doing great. This is just some examples of what you can do with critical care. This is a medical clinic, veterinary clinic in Nebraska, where finding specialists overall is extremely difficult, especially in the area of critical care. A dog presented with neuro and GI signs. The veterinarian who was working the emergency clinic started to try to stabilize the dog. The dog was not responding. They did arrange a video consult, and the criticalist was able to help guide the veterinarian on site in an AFAST exam and look at some lab work, recommend some further testing, revise the diagnosis, and they determined that the dog had actually been exposed to antifreeze. So sometimes this is really important, especially in critical cases, when you're stranded and alone and don't have somebody to refer to, what you can get from a referral. This is just another example. A dog presented to a specialty clinic, but they did not have a nutritionist on board, and this dog had a known portosystemic shunt and had hepatoencephalopathy. They really needed help stabilizing the dog, and so they were able to get in touch with a specialist at Cornell to get help for this patient. Horses. So this comes from Dr. Heilsberg, who is based in the Whitesboro part of Texas. And her biggest challenge is when she goes to see horses, not everybody who is a stakeholder in that horse's care is available. So by the time you deal with the owner, the manager, the caretaker, the trainer, all of the people involved, and everyone is either calling her for information or messages are getting miscommunicated. She found it easier to record a short video and send that to everybody. The other thing she is doing is for wound management. So she doesn't have to go to the farm every day. She's a solo practitioner. She does schedule follow-up video consults to monitor the wound management. And based on that, she can determine if and when she needs to go back to the farm. She has a wound care package price, so the virtual visits are included in her wound management fees. And she does explain that to the owners, especially if they're shopping, and determine that her wound management fees may be higher than her neighbors. Food animal safety, telemedicine is way beyond companion animal here. They have all sorts of devices for remote monitoring, determining if there's going to be early onset of bovine respiratory disease, diarrhea problems. They can determine even before an animal shows symptoms if a herd needs to be isolated or treated. This is also something that helps a lot with some of the strain that we're seeing in rural veterinary practices. They take huge advantage not only of digital imaging, which we do too, but for pathology and necropsy, they're doing a tremendous amount with that as well. So we talked a little bit about teleconsultations. Referral is not always an option, frequently because of geography, right now because of pandemic. Certainly during hurricanes, we've seen that as well. You just can't get to where you need to be. So sometimes you have to do the best you can, just having a consultation with a specialist to help you triage your patient and determine if it's really worth making that trip for the referral. We see this particularly on the large animal side when you need to determine if a horse or cow needs to be trailered up and brought somewhere. It's also huge for supporting recent grads or even more experienced veterinarians who may be faced with a difficult case of something they just don't see on a regular basis. Other things to think about, pricing models, and this seems to be something that we get asked about a lot. Almost every platform that is out there, you pay ahead of time, as in the client pays ahead of time. So whether it's a pay-per-use or a bundled pricing or a subscription plan, a lot like Uber or Lyft, your credit card is already loaded into the platform before an appointment can be scheduled. So the appointment, there has to be a mechanism for you to receive pay. And if the credit card information is not loaded, then the appointment will not even be processed. And you will probably not even be made aware of the fact that somebody is trying to reach you. The bigger issue is determining, do you want to do pay per use? You could do something like Dr. Heilsberg does with bundled pricing for certain types of cases, or do you want to do a subscription plan where an owner pays $15 a month and they are allowed so many virtual visits a month as part of that subscription plan. Other things to think about is workflow for you and your staff. How are appointments or these visits being handled? Are you blocking out a time during the day to do it? Is this something you're going to be doing in between seeing patients? And how do you make this a value for clients? And this is something that we're seeing a lot of, particularly right now. When clients can't come in and they're just calling on the phone, what are they wanting? They need your knowledge. And that is something they cannot get somewhere else. They cannot get from Dr. Google. They cannot get from their next door neighbor. They cannot get from social media. And so this is certainly a way that you can implement the ability to train clients to value your knowledge. And certainly flexibility. Right now, you may have a lot more flexibility in utilizing telemedicine. And as you get comfortable with it, you will also get a sense of, as things return to normal, how do you want to continue to incorporate that into your practice? Cost, what is the cost to you? Every platform is going to have some kind of fee associated with it. It could be a monthly fee, it could be an annual fee, it could be a fee that is based on the number of virtual visits you do in a month. It could be a percentage or portion of each individual visit that you have. So it's important to look at that and consider what you think your caseload will be and how best to manage that. And certainly right now, during the corona pandemic, several platforms are offering their services at no charge for 60 days. So it's certainly a good way for you to try them out. And of course, what you want to know is what happens when that 60 days is up. Are you just done, or are you then tied in, and what do the fees look like that? Major thing with any kind of virtual care is the stability of the connection. So internet or cell service, you're not going to be able to do a virtual care visit if you don't have a good connection. Then a lot is platform dependent. We talked about computers, video cameras, microphones, mobile devices, things like that. With regard to pet health insurance, yes, many of the pet health insurance products do cover telemedicine. Part of the order from Arizona was actually that they had to, that just came out yesterday. If you are substituting a virtual care visit for an in-person visit, then the insurance company needs to pay that in the same manner. This is something, lots of questions about what platform should I use. I would love to be able to say that you should just go use this platform or this platform, but just like not every practice is the same, there is no cookie cutter one size fits all platform for every practice. This is something that the AVMA has put together. They have a tremendous resource at avma.org/telehealth. Lots more resources. This chart is one of the resources. It lists several of the reputable platforms that are out there. So something that you can go look up. You can see what their business model is, how to reach them, things like that. And we just found out yesterday that Tractor Supply is now offering telemedicine services to their clients. And so I think it really behooves us more than at any time to be the people on top of this and the people who are offering this to our clients and patients. We know what happened when Tractor Supply started selling antibiotics and vaccines, and that was not something good for veterinary medicine, nor was it good for our patients' welfare. We talked a little bit about pet insurance. So Pet First has partnered with AirVet, Vet's Choice with Televet. Embrace is paying for visits in general. Banfield and some of the other national corporations with their higher end wellness subscription plans include telemedicine as part of that. And because the biggest comparison that we see for using telemedicine in the veterinary profession is comparing it to pediatrics. These are just things that come from the pediatric literature. A lot of it has to do with documentation. And just so you know, there has been no litigation filed for veterinary telemedicine as far as the standard of care. The only thing that we have seen lawsuits from that y'all are all familiar with is Hines' case when he was taken before the state board for not establishing VCPRs. So as far as standard of care and appropriate treatment, there has been no cases filed on the veterinary side. And there was a study done on the human side, and medical malpractice concerns have also been much lower than were expected. That doesn't mean they're not going to come. They will happen. They will happen on both the human side and the veterinary side. But as we all know, people can file complaints and file lawsuits for anything, and that doesn't mean they're valid. There was another study that compared assessing children that had fevers and children with respiratory distress via virtual care and versus bedside and hospital care, and the findings were the same. They found that virtual care and the age range for these patients was 0, so 0 years, infants, to 18 years. And both visits were equally effective in caring for those patients. Then the one thing and something that we really do need to pay attention on the veterinary side and learn from our human colleagues is that when utilizing virtual care, there is much more likely to be an overprescribing of antibiotics for children presenting with respiratory signs through a virtual visit than through a visit to an urgent care center or to their own primary care or pediatrician. So things we can learn is we still need to be very judicious in how we prescribe our medications, whether it's antibiotics or pain medicines or whatever, appropriately. So some of the things to think about when using digital health, also known as webside manner versus bedside manner. Keep in mind with a lot of the platforms, especially if you don't have a video connection, that people lose they cannot see your facial expressions or your body language, and they lose tone because they may not be able to hear your voice. So that's a big thing, is making sure that in your communication you are using empathy. You may even have to overdo it a little bit. No matter what, you want to do what is best for the pet. So don't let an owner pressure you, whether because of finances or because of their schedule, or because they don't want to leave the house. If this is a pet that you really think needs to be seen in the hospital, then you need to make it clear that this pet needs to be seen in the hospital. You always want to obtain as much information as possible. Certainly, since you're not going to be putting your hands on the animal, you need pictures, you need videos. If they do have a pet Fitbit or some kind of collar device, you can get that. You can teach people to get respiration rates and heart rates. I certainly would never recommend that somebody obtain a rectal temperature, but you may be able to have the owner get an axillary temperature and use that information. All of those things are things that can be helpful. Educate the owner about what's happening, especially because there's that lag if you're using a text-based platform. So let them know what's happening and why it's happening. Always try to follow up to make sure the owner is being compliant and determine what the outcome is. And as always, hope for the best, but prepare for the worst. So when you make a recommendation, just like I did with the dog with the interdigital cyst, let them know what your expectation is for treatment, but let them know what to do if the treatment isn't going as you expect it to. So always provide them with the next steps. And now I will take questions.
Dr. Teller, we've got a question from an ER doctor.
Okay.
Basically, the question is that the clinic I'm working at is implementing telemedicine, and just wanted to make sure that this new telemedicine was going to work or not going to work in an ER setting. So do you have thoughts on the use of telemedicine in ER practices?
I do. You're probably going to need to have somebody signed to do triage. Some of the platforms have what's called an urgent care feature. And so it will ping the person who is covering the triage station and let you know somebody has a question. They need to know if this is an emergency, if they do need to bring their pet in. So there are some platforms that do it. VetNow is one of them. It can certainly work with some of the other ones. When you're doing triage, you can turn yourself on, and if you're getting overwhelmed with cases, you can turn yourself off. But there are ways to triage through the platforms. If you're being overwhelmed during the pandemic right now, this may not be the best time to implement it. It's going to have to be done when your caseload tends to be a little bit steadier, which I realize is easier said than done. But several of the platforms do have an urgent care feature where an emergency clinic could triage.
Okay, thank you. In response to your mention of Tractor Supply, someone has asked, how is Tractor Supply doing telemed when they don't see animals?
It's a great question, and I'd love to be able to answer that for you, but they are offering it. They sent an email out to their customers and clients. They have a service where there are apparently veterinarians or veterinary staff on the other end. And I could not tell you if they are just providing general advice or if they are violating the VCPR and providing diagnosis and treatment. But certainly not something good for us, and behooves us to, one, stay on top of what they're doing, and to make it available to our clients so they're not tempted to go to Tractor Supply. I will tell you, one of the things that we have learned is that clients would much rather, when possible, have a virtual visit with their own veterinarian. They have that bond with you, you have their trust, and so whenever possible, they would like to have that visit with you or with somebody that you recommend. So the other platforms are what they're turning to, including Tractor Supply, if they can't access you or somebody you trust.
Okay, thank you. We've got another question do you recommend we wear our normal professional attire, scrub top, etc., or is it okay to just be dressed appropriately?
That's a great question. So I think if you're doing it during the daytime, dress professionally, but if you're choosing to do some of these after hours, or you're just out and about running around in public, or I sat next to somebody at a meeting who was really bored in a lecture and was just doing virtual care that way, at that point, the client's much more interested in getting your help and is probably not paying a whole lot of attention to what you're wearing. Of course, if you're in a bathing suit or something like that, not appropriate. But I think if you look reasonably put together and professional, then you should be fine.
Great. Still have a few more questions coming. What is the case volume you typically see with day practice?
That varies, and now that the pandemic is upon us, it varies more. I'd say overall we're seeing probably 10 cases a day. When you spread that out, different practices may be seeing different amounts. I think some of that depends on what they are willing to offer in person. So some practices have gone truly to just emergent things and are putting off other procedures so they can see more virtually. Practices in locations where there may not be a shelter in place order, they may be able to do more, and they'll have fewer virtual care cases.
Okay, another question. Do you have recommendations to introduce charging for telemedicine to our clients that we have already been doing a lot of communication by text, etc.? We have launched video appointments during COVID, but worry about starting to charge for things we have already been doing at no charge.
Yeah, and it's a great question. And one of the things, especially if you use a third-party platform to launch telemedicine and aren't doing it just through FaceTime or Zoom, is whatever platform you choose to go with will often supply marketing materials, send the information out to your clientele. But some of the things that they get beneficial from it is the visit is captured, so they have access to that visit, especially in this time. Say you're treating something that you think is urgent but isn't emergent, and you do that at 4 o'clock in the afternoon. By 10 p.m., the dog has deteriorated. You're no longer open or available, and the dog does need to go to the emergency clinic. The owner has access to your discussion, the entire exchange you had, and they can take that to the emergency clinic. So the ER clinician has an idea of what the thought process was and what may or may not have happened since the virtual visit. It also integrates with your PIM system. A lot of these platforms do, so you're not having to then go back and retype things into your PIM system. But I think the biggest thing is just saying, Dr. Smith is really busy right now. I'd love to have dedicated time for you to visit with her about Fluffy. We are offering this new virtual care platform, and let me tell you how you can access it, and we can arrange for Dr. Smith to see Fluffy at 3 o'clock this afternoon. And please upload pictures, any other information that you think may be relevant for that. Overall, we've seen really good uptake by the clients. They really seem to appreciate it. They like the connection that is offered to them. And sometimes it's a matter of getting what you pay for, and they actually feel better about it when they've paid for your knowledge.
Well, we have probably a pretty good follow-up to that question. What is your opinion on using a platform versus using Zoom, FaceTime, and PayPal or Venmo?
I think it's just very fragmented. You have one of your people trying to set up a Zoom link or arrange a FaceTime call. Somebody has to get the credit card information. Especially if it's not Venmo, somebody has to get it. You can have errors on manual entry of these credit cards. You're not getting confirmation that the charge goes through. things like that. It becomes very fragmented for your staff. It's not great for the workflow. The other things to keep in mind, especially unless you're using a medical grade of Zoom, is the security component. So we do still have an obligation for security and confidentiality, and those are not part of FaceTime or Zoom. And not that anybody right now, I think, is going to go after you for it, but moving forward in the long term, it's important to remember that those laws and rules are not going to go away, and that you need to be able to ensure that the exchange that you have with a client, one, is confidential, and two, both the data and the credit card information is secure.
I've got a few more. Hopefully we'll get to these before we wrap up here. The doctor says, I do a lot of bulldogs in my practice. I get calls from all over the U.S. At least 50% are from clients desiring information only. So far, I have been very cautious and have declined giving detailed information. I have just tried to refer to a veterinary practice in their area. It is becoming very time consuming. I need to charge, but need it set up the right way, i.e. software company to set up the system.
So I would definitely look at one of the telemedicine platforms, and different platforms work a little bit differently. Some of the platforms, you can set it up so only your clients can access you through it. So you know that you have a established VCPR with them. Other platforms, you can open it up so that non-clients can reach you. But you need to understand you can only offer them general advice. So you cannot create a diagnosis or a therapeutic plan for them. But you can certainly provide educational materials. These are the things to look for as the pregnancy progresses. Is a scheduled C-section appropriate? This is what to look for if the dog does go into labor. So without making an actual diagnosis or treatment plan, there are still a lot of ways that you could provide educational resources to these people. And yes, having owned a Frenchie and having parents that had a bulldog, God bless you, you definitely should be paid for sharing that knowledge.
And that doctor had a follow-up to it, which is, can you do this while you are out of state from your practice?
If you are licensed in the state where you are practicing, then yes. So as long as you have a license for the state, then you're fine.
So in follow-up to that, should a Texas licensed veterinarian only be practicing on Texas residents via telemedicine?
So so this would be a debate amongst the various different organized veterinary medical associations. Some believe that you need to have a license in the state where you practice and then a license in the state where the patient resides. Others believe you just need to be licensed in the place where the visit takes place. So there is no great answer to that. You could certainly be licensed in Texas, have a Texas resident who's on vacation and reaching out to you. And I have done that. That may be a great zone for Chris or Liz to answer, but I don't have any qualms helping a client of mine who has moved to a different state or on vacation in a temporary state, knowing that I had established a VCPR with them previously. I may be stepping out on a limb there, but I'm doing the right thing for the animal. So I'll let Chris or Liz potentially weigh in on that one.
Okay, well, we've got a handful more, and these hopefully will be quick ones. Is Virtual Vet a platform for Texas A&M University only?
So Virtual Vet is what we have named our telemedicine program. It is powered by VetNow, which is not an A&M only platform, but we are calling our program Virtual Vets. So hopefully that answers the question. We did not create our own platform. We are using a third-party platform.
Okay, and I think this has already been offered and answered, but do you recommend using a third-party platform over DIY?
So yeah, and Yes, I think I did answer that. I personally think it is easier that way. Record keeping is certainly easier. You can track your visits. You can make sure the credit card information is entered. It allows you to make yourself available or unavailable on the platform, so that if an owner is reaching out to you and they'll just get a message that you are not available versus them calling your clinic. The clinic says, Dr. Smith is not available right now. Let's set up a Zoom or a FaceTime or whatever. And then someone else has to collect the money for it. I think it just gets very fragmented. I can certainly understand wanting to do it right now, while you're trying to figure out how to handle things during the pandemic. But I think long-term, it's certainly less efficient. And of course, as we talked about, the confidentiality and data security.
Okay, last question. Is a license needed even if offering just general advice and resources and not diagnosis?
Well, you need to have a veterinary license, but you don't need to have a VCPR.
Makes sense. And the last thing is just, and I don't know if you've got that resource available, and I think someone may be putting it up there, but someone asked, is there a list of service providers like the one you had on their list earlier that you could provide?
It looks like somebody posted the link, but if you go to avma.org/telehealth, it will take you to the entire resource center, and that list of providers is in the resource center.
Terrific. Well, we're here in the last couple of minutes. So first I wanted to thank Dr. Teller so much. That was an outstanding presentation. I hope everyone presenting gained some helpful information that you can put to use in your own practices. As always, if there's ever anything TVMA can do to assist you, please don't hesitate to contact us. With the pandemic, the staff is working from home, but you can still call the office and actually get the person that you're looking for, and it will transfer to their cell phone at home, so you'll get a live person. Or you can simply shoot us an email at info@tvma.org. We're always here to help, and we know that there's so many questions and things that you are all dealing with. So please lean on TVMA if there's anything we can do to help. And with that, we'll call the end of the webinar. And again, stay safe, everyone.